So what are the system interventions or actions or collaborations or what needs to what do you think would help this?
Yeah, it's it's a great question. And a lot of that stuff, as you might imagine, the ER is we're the downstream, right? So when they get to us, in my opinion at least, things have already failed because and I'm not
Right.
saying you should view a visit to the ER as a failure, but in some ways, there are some kids who are so severe that that should happen. But there's a lot of kids that if they had more help upstream, if
Yeah.
there were more mental health providers, if they had easier access to mental health providers, if there if the supply was more, I think you would avoid a lot of what we see where kids end up
Mhm.
where we are.
Yeah.
From our standpoint, I think that setting aside specific observation units that are solely devoted to mental and behavioral health patients where the care is standardized and the multidisciplinary aspect of this is really important where you've got to have psychiatrists in the emergency room. You've got to have mental health workers in the ER. You got to have behavioral response teams in the emergency room. And to be able to do all of these things, you really do need a devoted space because of the things I just said. If your department's full of acuity, you're going to have nurses pulled for other things, for sick patients who need care right then. It's just, it's not ideal for that. So I think from our standpoint, we can certainly design the care model a little bit differently where we're delivering care in a more standardized, less variable way. And then on the other side, so that's the input and then the ER and then the output, it seems easy to say, and there are subtleties to this that I'm sure I don't know. But if we could staff the beds that we do have, if there was enough reimbursement to promote people to go into these various fields that care for these patients, then that would be a huge win. And we're certainly trying to add physical space up here, at
Mhm.
least at Children's, for this. The depressing thing is to think we're going to add all of these rooms and potential facilities, and yet if there's nobody to staff those things, it doesn't really matter. And so there's certainly investments that need to happen at that level, the end result of this too.
Yeah.
I think all three of these areas need
Wow.
work.